From the JAMA Network, this is JAMA Otolaryngology Head and Neck Surgery Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Otolaryngology Head and Neck Surgery.
Hi everyone, this is Dr. Paul Bryson, your web editor for JAMA Oto. I'm pleased to be joined today by Dr. Theda Kontis and Myriam Loyo to discuss their recent commentary on gender equality in facial plastic surgery, a female president's perspective. Welcome to the podcast.
Thank you.
Thanks, Paul.
Sure. Before we get started, do you mind just introducing yourselves to our listeners? And then we'll spend some time just talking about the commentary, but also with Dr. Kontis and your role as now immediate past president of the American Academy of Facial Plastic and Reconstructive Surgery.
Yes, thank you. My name is Theda Kontis. I am a facial plastic surgeon in Baltimore. I am part-time faculty at Johns Hopkins. I am immediate past president of the AFPRS and the second woman president.
And I'm Myriam Loyo Lee. I'm also a facial plastic surgeon. I'm in Portland, Oregon, and I'm a full-time associate professor at Oregon Health and Science University. I've known Theda since I was a medical student, and it was a pleasure to see her be the second woman president of our academy. So I'm really excited for our conversation today.
Well, it's great to have you both on, and my area of expertise is in laryngology, so I will submit to you both that I wasn't aware of some of the officerships within the organization. And so I guess as we get started, Dr. Kontis, can you share with us just your journey within facial plastic and reconstructive surgery?
Sure. I, as a resident at Hopkins, was my year one of 4 women in the entire program. And there were 2 women ahead of me. And then me and another woman my year were the only women in the program forever. I think there maybe was one woman many, many years ahead of us, but they just started the year ahead of me taking women into the otolaryngology residency. All of the faculty were men. There was one woman faculty member who was part-time. She was a otolaryngologist in private practice in town. And that was the only woman that I had exposure to as a resident. And it was quite different for me operating with her. I felt more of an equal. I felt that she had a little more interest in training me. And I would laugh because my fellow male residents would almost represent themselves to the other attendings who sort of lost track of who was what year. They would represent themselves as a little more experienced than they were. So they would get to do better cases. They would get to do more of the cases. And the women would say, well, I'm only a PGY 3. I've never done a septum. And so I think we got a little less attention and a little less instruction because we gave the truth about our experience, and women have a tendency to not promote themselves. So having a woman teaching you and taking you through a case is a very, very different experience as a woman.
As sort of a pioneer in the program, really, it had only been a year or so before there were other female residents. As you look at that intermediate term, as you went from a junior resident to a senior resident and then as a faculty member, how did that change in that first 10 or 15 years, I guess, from the onset of your training into that early, not quite middle part of your career? Did the same sort of behaviors continue to ring true, or have you seen changes?
Well, I thought that I was going to go into academics. And as I worked my way through the residency program, I realized that that wasn't going to work for me. I just didn't want to be the only woman faculty member at Hopkins. Not that it was offered to me, but I did decide along the way that that was not going to be a career path for me. So when I decided that I liked facial plastics, one of the faculty members, Dr. Ira Papel, took me on as his first fellow with the understanding that I would join him in private practice. And we sort of have a lovely relationship with Hopkins that we train the residents. So as a private practice person, it's almost academic, but I don't have to deal with the politics of academia.
That's good. You kind of get a little bit of both worlds. And when you think back to, I guess your approach to trainees, men and women, how do you approach training the residents? And what have you observed in your career as the residents come through?
It's obviously wonderful to have more women coming through. We have a group at our academy called the Women in Facial Plastic Surgery Committee. And every year we have a luncheon. And when I first started, we had one table of women at the luncheon. And this year it was sold out. We didn't have enough tables. It was, I forget, 60, 70 seats. So it was so heartwarming. It makes me so happy to see how women are coming up in the ranks. But, I will tell you an interesting story about our academy in that I'm only the second woman president, and it has been long coming. And the reason is not only were there very few women, but women weren't encouraged like the men were to increase their membership level. So once you finish your fellowship, you can change your membership level to fellow rather than member. And in order to be a committee member or an elected representative for the academy, you have to be a fellow. So when the nominating committee would work on trying to find people to put into these board positions, the women weren't encouraged to increase their membership level, and the guys were. So many times they would say, well, what about this person? Oh, well, she's not a fellow, so she doesn't fit the bill. So there was this delay of getting women pushed through to even be qualified to get to these positions. Although they just weren't listed as such in the academy.
What were the criteria? Were there different criteria from membership to fellow, or was it sort of just sponsorship and promotion?
It was that they weren't contacted, that they met the criteria and they needed to change their membership level. But what would happen is if a guy were nominated and they'd say, well, he's a member, he's not the right level, people would say, oh, he's got to be. He finished 5 years ago. Call him and tell him to change his membership level. But that didn't happen with the women.
Yeah, it doesn't take much to envision that when things start to hopefully change, then that it takes cycles to get more people in roles.
Exactly. And we've corrected that. So now we've got many more women on the board. We have women fellowship directors, which we hadn't had. And also, I'll talk about elections too. I lost every election I ran for because you ran a woman against a man, the women would lose all the time. So I told the academy, if you want women, you have to run women against women, which they did. And then, of course, I beat another woman who didn't win any elections ever. So that was sort of a bittersweet kind of thing. But it was the only way to sort of break that barrier and get women into the elected officials. And even when I ran for president, they ran me unopposed. So it's been a tough journey in facial plastics.
Yeah, it sounds like a lot of the traditional barriers that you hear about. And what have you observed with other colleagues and other subspecialties? I'm sure in your role as president, you get to interact with some other leaders in other areas. Has it been a similar sort of barrier and journey situation in other specialties or with other organizations?
Well, I'll tell you something that circulated among all the women in facial plastics is there is a woman dermatologist who does a lot of Instagram reels and posts. And she was talking about the women representation in the elected levels in their societies. And she actually pointed the finger at facial plastics and said, dermatology's done great getting women involved. Plastic surgery's done great. And she said, facial plastics, not so much. And, we really had some hurdles to jump through.
Was that call out helpful, do you think? When you see that sort of thing, does that sort of social media ping get talked about with the leadership of the organization? Does it seem to trickle down to younger members?
Absolutely. I think we've turned the corner, now. Women are much more represented. I think that physician now would say facial plastics is making progress.
Myriam, you're at a younger point in your career, what was it like coming through for you as you looked at career choices and you honed in or developed your interest in facial plastic and reconstructive surgery? What did that look like for you?
Thank you for that question. So things have clearly changed for the better. I was a resident where there were women that were faculty, and there were a good mix of residents that were women. In fact, I was a medical student who rotated with Theda in her practice when I was doing my sub-I. So it's really, really great to see women doing the jobs that I think I want to do. However, even as I think about that, there's still gaps. So when we were preparing for this viewpoint, we looked up gender equity in otolaryngology, and the best statistics were from 2017. In 1 in 3 residents is a woman. So it really doesn't represent the population or the medical student population. So we're not at 50% for the residents in otolaryngology yet. And we also looked at gender equity for specialties. In neurosurgery, orthopedics, and otolaryngology had the worst parity when you look at residents and faculty and leadership positions. So we're doing better, but there's room for growth. And as Theda was talking about all of these landmark moments when we had women in leadership roles, I wanted to highlight that the AFPRS was founded in 1964. And the first woman president, it really took 50 years. So that was Myriam Moran in 2019. And it's similar for the board. The American Board of Facial Plastics and Reconstructive Surgery elected Catherine Winslow in 2019. I know when Myriam Moran was elected, it meant a lot. I had so many women talking about it and submitting papers talking about gender equity to say we're doing better, but it's still here. We need to shine the light on it and work on it to make it better. So I'm really thankful for Theda being willing to talk about this. I don't think we ever want to come across as complaining. I think it's more like, how do we engage everybody and get us to participate? I don't think anybody meant for those women that Theda was talking about to not become fellow members, but it happened. So how do we prevent things like that from happening? And so I think we're doing a lot better, but I still see a lot of panels that are only men on the stage. I think we're doing a lot better, but the board for our academy is not 50% women. So there's room to improve.
As you take on that leadership role, Dr. Kontis, and you have this perspective and experience of your background and training and what you've lived and built your practice through, can you speak to any sort of infrastructural or process things at the organizational level that can help with some of these barriers or awareness? Things that come to mind are that professional network and those sponsorship and mentorship moments and opportunities. Can you speak to that as you became president of your organization?
We have definitely utilized mentorship programs, and I think the women really enjoy that. Podium time is really an issue. And when I was the chair of a meeting, one of our academy meetings, I realized how aggressive the men were at making sure that they got podium time. They would contact me. They would send me 30 talks that they wanted to give. And the women would say, well, I don't know anything that I can teach these people. I'm not going to submit anything. Meanwhile, guys who were like a year out from their fellowship had lots of talks they wanted to give. So it really took a lot of encouraging women to understand that they do have things that they can teach, and they do need to be aggressive about podium time, and they do need to advocate for themselves. And women don't. At one of our luncheons, I tried to get all the women riled up and excited about being more involved. And there's a Greek word that's called axios, Axios, and it means worthy. And when you're congratulating someone in Greece who's won an award, you don't say bravo, you say axios. So they are worthy of this. And so that became sort of our women's group code word, that you are worthy. You have to believe in yourself, that you do have things to give and things to teach, and you are able to take on these leadership roles. There isn't any reason that you can't. But it's sort of an innate thing with women that we just feel that, we're not worthy.
It's very interesting. I mean, I suspect when we go to meetings, sometimes it's the same voices that seem to be, like you described it, as podium time or, gatekeeping time almost, right? It's a challenge to try to get people to make them feel that they can put themselves forward and they have a perspective that may round out the panels, presentations, and things that would be different, right? I mean, sometimes it's the same voices.
That's exactly right. And once you stimulate these young minds to think about something you could present, and well, I'm doing, something different, well, present it. But there's a little bit of fear, like, oh, what are they going to think of me? It's a scary process. But the mentoring that we do, I think, really is getting women to feel a lot more comfortable getting on stage, getting at the podium. And what do you think, Myriam? You certainly give lots of talks. I think you.
No, I'm nodding my head, and I'm also thinking, like, if I want to encourage people who are organizing panels or sessions to think about diversity in gender and in race and ethnicity. I think it really matters. And even if you think someone is more junior and is not ready for a keynote presentation or a large solo presentation, to think about including them in the panels, I think that can really help people dip their toes into podium presentations. I mean, I definitely didn't start with a 30-minute talk 1 year out of fellowship, And so I think that sponsorship and mentorship has really made it more comfortable for me to submit papers, to participate and be engaged. I remember you telling me this exact story, Theda, like probably at a meeting, and then I submitted a little surgical pearl that was a 5-minute video. And so I think it starts with little things like that.
Yeah, I mean, even like when you assemble your program committee, right? Sometimes having some diversity on the program committee will create a more diverse or unique program, right? Sometimes it's certainly the speakers that are speaking and the panels that are constructed, but sometimes you can have a pretty interesting program committee that may have a whole array of interests and backgrounds that maybe can kind of feed it down to the rest of the program.
It's true, but sometimes you have to really pull the women in. The women don't just say, here I am, I'm ready to give a talk. You'd have to really encourage them to become involved.
I suspect there'll be people that really enjoy it, right? It can be so facilitating and empowering to, next steps in a career or ways that they might even mentor.
It is. It starts the ball rolling, because they give a talk, they do a good job, they give more talks, they enjoy it, then their name gets out, then they're invited to give talks. So they have to take that little step. And even I tell the fellows, give a talk on your first 5 rhinoplasties and what you learned from them. There's plenty, or, starting your own surgery center and what are the 10 mistakes you made doing that. There's so many things that you can give a talk on. It doesn't have to be my technique in the deep plane facelift and why it's better than yours. There's plenty of beginner talks you can give, and the audience is diverse enough that those things appeal to quite a few of the participants.
Yeah, those are great points.
And I keep thinking about how powerful women's voices are. There's been some really cool research now showing that for some surgeries, female surgeons have better outcomes and provide cheaper care and have less complications And so I think if we include more voices and include women's voices, we're going to be able to capture that knowledge that might not be as explicit right now by just engaging in the conversation. And for facial plastic surgery, the vast majority of our patients are women. Women have a lot of the discretionary spending. I really think there's a lot of power in engaging women's voices.
I really appreciate your time today and being part of the podcast and sharing some perspectives on your training journeys, your leadership journeys. As we wrap up today, any take-home points, any things that we missed in the conversation that you wanted to highlight before we sign off this episode?
I think you were very thorough, and I think I told a lot of stories. But for the women who are listening, just lean in, as the book says, just keep going forward, be involved, realize that you're worthy. And I think that we will continue to have a nice voice in our academy. Thank you for allowing us to give our perspective.
Well, it's hard to follow that, but I think I will add for the women who are listening, it is okay to be ambitious. It is okay to want to have children, take care of your parents. It is okay to want to do private practice or academics. And if you want to reach out to me or Theda, please do so, because we're so happy to talk about things like this for professional development.
Well, I really appreciate it. It's been great to meet you, Dr. Kontis, and to talk with you again, Myriam. So until next time, thanks so much.
Thank you. Thanks for having us.
Thank you, Paul.
This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.